after surgery.
Me, Roger, is the first.
Okay.
You live local, right?
Yep.
Lefty. Kira's right to the left, yeah.
We'll do a CAT scan and the MRI here.
Yeah, if we need to get it done sooner, we can go to Westerly. And you're a psychologist, so you don't need anyone to talk to.
Quite the opposite.
Right? Oh dear.
Quite the opposite.
No, I'm good.
Man, if you,
I actually already have some. I'm already seeing a psychologist.
That's true, I forgot. That's
So-
true.
Yeah, you have to because of what you do.
Exactly.
Exactly.
My major in college was psychology.
Oh,
That's
yeah?
why. Yeah. Alright. I think you're gonna be just fine. I'm just. No one could take away the shock of like, oh crap.
Yeah.
You know, but
yeah.
I'm very glad your sister called you.
No,
Because
seriously.
otherwise, you know,
I'd be.
so you
wait
know
till
the
50.
I'm not. So he didn't do anything wrong. The bleeding thing, on and off, can happen. It could be internal hemorrhoids, and it may not even be related to this. So suppose we were unfortunate enough to find it now. When would we find it?
50, right?
No. Well, they changed it to 45, but
Oh,
you're
okay.
39.
Yeah.
From what I see, when would you have symptoms? It wouldn't be for 6 to 9 to 12 months. It could be a year from now when we find it. It doesn't grow very quickly at all.
That's good to know.
So it's been there.
These are the things
For a while.
I can
These
understand.
are the things. So this has
when you
been
say
there,
that.
you know, at least, from what I can see, at least 9 months, a year, could be longer. This process started years ago.
Mm-hmm.
And so we can blame his parents because it's the half sister. So it's your mom. It's her fault. It's all fault. It's her fault. It's her.
We've already determined that.
Yeah, it is.
Yeah, she's very faulty.
Yeah. So that's what it is. We're not that smart as humans. So we did genetic testing for the ones that we know about, but it's probably you probably have some inherited things that it made this come out
Sure.
faster.
Yep. That makes
So
sense.
smoking in the past could participate in that. Everyone worries about lung cancer, but it can. There's 400 toxins. And so
Yeah.
it's part of life.
Yeah.
It's nothing you did. It's just bad luck.
Yeah.
And
Yeah.
I think we just have to acknowledge there's a problem. And you can't think of this as a cancer. We have a problem
Right,
that we can fix.
right.
As far as I can see, totally can fix this.
Excellent.
It's just going to involve, to the best of our ability, let's characterize the problem, and then we'll do what the best treatment is. Now, about 35 years ago, the doctors in the community, things were coming out right out of World War II. The better surgical techniques were coming out of Sloan Kettering in New York in the 50s. Chemotherapy came out of World War II. And there weren't even oncologists. They were called chemotherapists or something. Anyway, it was a dichotomy of care, and it was all over the map.
Mm-hmm.
The big centers were doing research and trying to improve things, and they were getting results. In the community, not so much. So they developed these guidelines about 35 years ago.
Okay.
So basically, in this country, 85% of the people get treated in a community center area, and then about 15% in a big academic. But the treatment is the same. Same drugs, same treatment, given the same way.
Okay.
I treat everyone like family. So if there's something that's better, I'm like, fine.